Hi friends, this is Dr. Abdequaem Chimthanawala. Today I will discuss a case of a skin disease. There was this patient who came to me. He had a lot of itching in the body, and this was since about I think 4 to 5 months. He had a lot of itching of the body, and he had no relief till the time he used to take some medicines, some ointments, used to feel better, and again he used to feel the same thing. And as such, there were no other symptoms. There was only itching and eruptions in the body. On further inquiring, I asked him that any other complaints. He said, sir, I get a lot of perspiration, and when there is perspiration, the itching is more. And he was actually working in a store which had which sells woolen. They sell woolen, so he could not answer my mind symptoms and all. He was basically that worker who works in a shop where he sells woolen. Then I asked him, see, now you have to see how the patient speaks, and from the little knowledge we have, then we have to ask him questions which he can answer properly. So I said, when do you get perspiration? Perspiration everybody has. So he said, sir, whenever I'm angry, जब भी कोई कस्टमर बहुत चीज देखता है, the customer sees lot of things, lot of woolen sweaters, and it does not take, then I get very angry. And when I get angry, I get lots of perspiration. And that is a very important symptom, okay? Perspiration from anger. Now, if you get this symptom, then you must think of few drugs which have this symptom, perspiration from anger. You can think about chamomilla, you can think about bryonia, you can think about petroleum, sepia, aconite, cuprum med, ferrum phos, lycopodium, and of course sulfur. These drugs have perspiration when they are angry. But don't jump into the prescription. Now, if you have got a very important symptom, ask more. Then I asked him, what is the odor of perspiration? क्या perspiration कैसा रहता है? कि डॉक्टर साहब बहुत ही गंदा रहता है, जैसे बहुत ज़्यादा पसीना आता है, मैं थोड़ा दुकान के बाहर चले जाता हूँ और थोड़ा फ्रेश एयर लगती है, तो फिर मैं फिर से अंदर जाता हूँ बोले. That means, sir, he told, sir, the perspiration, the odor is very bad. I go out of the shop, take some cold air, and then again go in the shop and the smell settle down. This bad was the perspiration. So of course my next question was कि उसकी बास कैसी रहती है? How does it smell? And he said, sir, बहुत गंदी बास रहती है. The smell is very bad. आप अंडे देख अंडा फूटता तो कैसी बास आती है, वैसी बास आती है. That means he told me, you have seen egg, when the egg breaks, how does it smell? That is a smell of a perspiration. That's why sometimes I carry one extra shirt in my shop so that I can change if I have lot of perspiration. Now, if the patient is classically telling you that perspiration smells like rotten eggs, like eggs, you must think about two drugs. The first is sulfur and the second is plumbum metallicum. But we are not still finished with the case. Then I asked him, especially perspiration कब ज़्यादा होता है? अगर बाई चांस गुस्सा नहीं किए, if you are not angry and everything is okay, do you get perspiration? He said, sir, I get perspiration mostly in the afternoon with lot of heat. I get heated up, the body becomes very hot, then I get perspiration. Either because there is lack of fan or there is humidity, I get basically in the evening. And whenever I uncover, whenever you get perspiration, you basically try to uncover, you open up the sleeves. But he said, whenever I uncover, जब मैं sleep चढ़ाता तो पसीना ज़्यादा आता है. So this was the symptom which is very important in a prescription. And I took one symptom more, कि person working in woolens. So my friends, are you getting the symptom? So now if you see the symptom and repetize this case, first convert the patient's language in the rubric form and then repetize. So we have symptoms like itching eruptions all over the body. Second, angry or perspiration on anger. Third, Odor is like spoiled eggs. Profuse perspiration in the afternoon with heat, and aggravation from uncovering, a very important symptom. Now tell me friends, which is the remedy? Of course it is a very important remedy. You have read this remedy, but this case taught me one more symptom, that is eruptions, especially itching in wool workers in. जो भी वुल वर्कर्स रहते हैं, जो वुलन्स में काम करते हैं बहुत ज़्यादा, those are working in woolens factory, woolen shop, in those cases if there is itching and this symptom, you must think about Staphysagria. Yes my friends, I gave this patient Staphysagria 1M single dose and called him after 50 days. He said, sir, forget about the itching, my perspiration, no, जो मेरे को पसीना आता था बास वाला, वो ठीक हो गया. My perspiration which was so offensive like eggs, it is better. I am happy. Now I don't have to go and hide if I have perspiration. This is the most important symptom which is cured. Of course the itching is also better, but this I am happy, my perspiration is healed. Otherwise I have to use a lot of perfumes, change my shirt because of the offensiveness. These are the wordings of the patient. He is better. First the perspiration is better, the itching is also better. He came after a month's time, he was 80% better, and I repeated that dose after 2 months, and in 4 months the total itching, the perspiration, the offensiveness, everything is cured with 2 doses of Staphysagria 1M. This is how you must convert the patient's language into rubric form. So this is Staphysagria my friends for you. If you like this video, please do share and subscribe. Thank you.